Good afternoon from Germany to everybody. Just coming back from my clinic in Portugal. Welcome to the next world webinar of the European Laser Academy in collaboration with Photon Care. I'm happy that many students from all over the world signed in again. We will have about 2 hours, a bit more than 2 hours lectures. After 1 hour, we will have a break of roughly 15 minutes. And in the end, we will have 20 to 30 minutes for Q&As. Before I properly start, can everybody see and hear me, or are there any difficulties? In Panama, you don't get audio. That's a pity. But otherwise, I don't see any complaints. So I hope everybody can hear us. Yeah, today lectures is on the transcranial use of light, not only laser light, but photobiomodulation in general in different medical conditions. How is it possible to bring light through the skull bone into the brain? How much photons get transmitted into the brain? What are indications that have been described in the literature where photobiomodulation seems to be effective? You see already on the first cartoon, there are different tools to bring photons into the brain. We have 904, 910 near-infrared cluster probes. We have red light. We have helmets. All these may have different medical impacts. What's the outline for today? We will briefly touch what was already described in the first world webinar, which is free to see for everybody on YouTube. I'll give the link in the next slide about the different devices that are general available for photomedicine. A few words to the general concepts idea of biophotons. Then we, of course, have to focus a little bit on the basic information about the structures of the brain. Most important question when we talk about transcranial photobiomodulation is the question, which are the wavelengths that get the best penetration, and what are the specific effects that the different wavelengths do have on the different brain structures? Is there only one wavelength that's suitable, or are there many wavelengths that can be used for photobiomodulation, and which would be the medical indications out of it? We will go a little bit on first studies using photobiomodulation for treatment of Alzheimer, dementia. We will talk about the studies from Harvard Medical School by Professor Hamblin on the traumatic brain injury, closely associated with studies on stroke. We will look on some studies showing good evidence about the effectiveness of photomedicine in Parkinson's disease, and we will briefly touch photomedicine in depression, and one overlapping field with one slide in the end. Like always, laser can do so many things. It can be good for hair growth and regeneration processes as well. I mentioned I will give you again the link to the free access webinar, the first world webinar from summer of this year, Introduction into Photomedicine, where we covered the whole range from photomedicine according to the World Association of Light Therapy. Photomedicine can be applied for conditions like losing hair, facial regeneration, sinusitis, thyroid disease, COPD and asthma situations, chronic inflammatory bowel disease, neuromuscular disease, and so forth. all these topics are covered in detail in the introduction webinar that you may find under the link given here. Well, what are the laser probes that are available for photomedicine? The simplest one would be the laser pen, a device like this, available in visual red light, non-visible near-infrared light, as a CW device, as super pulse devices in many, many different forms. We can treat up to 12 points at the same time. So for those who perform acupuncture, this is like Chinese medicine, treating 12 points at the same time. But we can use the 12 light needles as well to bring lots of photons into a small area. We can use them in the shaped scalp as well. We can do area therapy by shower, which you see in the lower cartoon. We can use super pulse cluster probes in which very high peak pulses up to 300 watt with 100 or 200 nanoseconds, very short impulses are given. We can do non-invasive blood irradiation over the big arteries. We can do non-invasive blood irradiation by sublingual probes available by Photon Care. We can do invasive blood irradiation. This will be the topic of the next webinar in January. And we can do, of course, interstitial or even into the joint place, applying photons. And the big thing about interstitial invasive irradiation, we can use all the different colors of the rainbow. For transdermal use, it's basically red and infrared that is in the bioptic window, which gives good flow of photons down into the tissue. We like to introduce the Photon Care Germany helmet to get altogether 15 watts, so huge output power for irradiation in the near infrared area. And we will briefly touch, it's not the topic of today, the class 4 lasers, the high power lasers with big surface, which we may call photon booster because they bring a lot of photons into the tissue. Well, this slide I quite often bring in my presentations. It's taken by the former president of the World Association for Light Therapy, by my dear friend Praveen Arain, a dental surgeon who had published goods of research by regrowing dental tissues by photomedicine. The big question is, when we use light, what are we doing? We try to bring photons into a damaged tissue. We try to use light as a drug. Is it possible? Can we call light a drug? What's the definition of the drug? A drug is a substance that gets absorbed by the body and alters body function. And when we look on the light, even when we look on the sunlight, we do see, yes, sunlight is absorbed by the skin, for example, and is important for activating vitamin D. Sunlight is important for the vision, for rhodopsin activation. Sunlight is important for our sleep and night rhythm as directly effect on the pineal gland. However, we should be careful to call all what we say as the ultimate truth. What I share with you today and in the other seminars is the recent state of science in photomedicine. I just got a nice quote from Mark Aurel, the Roman emperor, who said, "Everything we hear is an option, not a fact." I try to give you evidence-based facts based on research, but it's my option. Everything we see is a perspective and probably not the truth. So whatever you do in medicine, keep updated, question yourself, get your own experiences. This is a nice small study I conducted with my friends from the university in Sigmaringen, especially with Professor Jörg Bergermann, biologist, where we just simply looked what is the effect of photomedicine on fibroblasts. We irradiated with different energy densities, and we saw that the best ATP production was within about 4 to 5 joule per square centimeter. And this is what given by the world as the rule of thumb to perform sufficient photomedicine. We have to apply about 4 to 5 joule per square centimeter energy density to get a beneficial effect. Already at this point, I may mention, in the brain, it's quite difficult. We have to penetrate all the different layers of the brain, especially the skull bone. So in the end, less than 10%, most calculations say about 4 to 5% of the external applied photons only penetrate into the CNS. Photomedicine in different tissues has different absorption peaks. There is not a single wavelength that is suitable for all our tissues. There is huge of research going on this stage. How is the penetration in the different tissues? And even the opposite, by the specific absorption peaks, we can detect what tissue we irradiate. So laser can be used, and this is my topic for today, for therapeutic purposes, but laser can be used for detection of different substances as well. Well, topic for today is the brain. And I'd like to start out with one of the huge philosophers from France, René Descartes. Ich denke, also bin ich. I think, therefore I am. And this, once again, is my big hope. Continue with thinking, question what you learn, and integrate what you learned to your own knowledge you had before. Don't take anything for granted. Yeah, transcranial LLT, a very specific topic within photomedicine. One of the biggest studies were conducted by Hamblin and collaborators on the traumatic brain injury, and they described in many, many experiments how effective photomedicine can be applied in traumatic brain injury. They got a huge grant from the US Army because the persistent damage of the brain, the persistent disability by traumatic brain injury is a huge financial and, of course, personal burden for the patients as well. And when we are honest from Western medicine, what can we offer? We don't have a single good effect in the treatment in traumatic brain injury. When I was a young guy and was working on intensive care unit, we gave high dose of corticosteroids, fortecortine. We hoped by this we could reduce the edema in the brain, but in the end, it didn't bring too much. So photomedicine, according to the studies of Hamblin, is probably a fantastic option in the treatment of traumatic brain injury. There are many different devices we mentioned briefly in the beginning for photomedicine in general, and there are many different devices we can use for transcranial photomedicine, for transcranial irradiation of the brain. There is a fantastic helmet which gives a huge amount of photons on all different places within the helmet, so we irradiate all of the brain. Good helmet like the Photon Care Germany helmet can be set from CW, continuous wave beam, up to 20,000 hertz, so 20,000 impulses per second. There are a few resonances, we will touch this later on, that seem to be very effective in neurodegenerative diseases, in activating brain function, in enhancing concentration, and calming down the spirits. I mentioned already now, we will discuss later on, this is the 10 hertz, the alpha rhythm, that seems to be very, very effective. When we do Tai Chi, Qigong, progressive muscle relaxation, autogenous training, our brain goes into the gate of consciousness, into the 10 hertz rhythm. Another good resonance is the self-heal resonance, the 4,625 hertz. And the solfeggio resonance, 528, seems to be very brilliant as well to harmonizing the brain functions. And some researchers claim that the 528 even reduces stress to the brain by 5G resonances, by the cell phone resonances. On the other part of the cartoon, you see different tools. Well, the shower is not a good thing, I think, for brain irradiation. If we want to irradiate targeted points, the pen is, of course, fantastic. And I will present one of the studies we conducted with the superpulsed cluster probe, by which we could show giving the 10 hertz resonance to a specific part of the brain, the prefrontal cortex, we could bring all the brain on the EEG recording into the 10 hertz rhythm. Well, here you see the effect that may occur by proper photobiomodulation to the brain. Either I use a pen for a specific irradiation of a point, and this is more precise than electromagnetic stimulation. This is performed for altering brain function as well. By this, I get the most targeted, most precise flow of information to a small area of the brain. Or I use the helmet you see in the cartoon, and then I irradiate all parts of the brain. What are possible routes for delivery of photons into the skull bone? Well, I mentioned already before, we have the most simple device of photomedicine, the so-called laser pen, by which we could irradiate, for example, with specific nozzles to the transcranial region. We can use the helmet to irradiate the whole brain. We can irradiate with the single probe, or we can irradiate with the 5 fingers superpulsed cluster probe to a bigger area of the brain. And we may use a device like the Photon Care Germany, which is not only suitable for intravenous interstitial irradiation, but which offers as well a sublingual probe. So we can irradiate systemically by sublingual irradiation. Before we come to the different colors, the different wavelengths for the penetration, let's just have a very short, very brief look on the anatomic structures of the brain. Basically, we can distinguish 3 parts of the brain: the frontal cortex, the parietal cortex, and the occipital cortex. Very roughly, very brief diversion of the brain. In the parietal area of the skull, the tissue of the bone is less than, for example, in the forehead. So if we want to bring photons into the brain tissue, the temporal part of the skull bone is the best to bring photons down into the CNS. In the babies, once the fontanelle is closed, you may use this thin bone as well to perform ultrasound irradiation. I didn't put into this presentation, but there is a study from University in Paderborn from Professor Sikora showing that temporal lobe epilepsy can be beneficially treated by photobiomodulation. Why is this the case? Because first, we get a pretty good flow of photons through this part of the skull bone. And what's the effect of photomedicine, of laser into the tissue? We mentioned in the first webinar, laser boosts ATP production, and by this, the ion channels get stabilized. They are energy dependent. They need ATP, adenosine triphosphate. Laser targets red and infrared, especially on the complex 4 of the respiratory chain, on the cytochrome C oxidase. So we activate the sodium-potassium pump, and we bring a higher membrane potential. And what's in epileptics? It's uncontrolled depolarization. And when I have a higher membrane potential, the risk of this uncontrolled depolarization is lowered. So according to the studies of Sikora, temporal bone irradiation in temporal lobe epilepsy in children was treated successfully in his studies by transcranial photobiomodulation. Well, the brain is a fantastic and absolute complex organ. 100 trillion synapses in a single human brain. Maybe there are some people with less, but let's say the healthy person, 100 trillion synapses in a healthy single human brain. They are organized into exquisitely complex circuits responding to knowledge, to experience, to drugs, traumatic brain injury, diseases, and other injuries. One of the most mysteries of brain science is how neuronal activity gives rise to behavior and even consciousness. We may limited understand the physiology of the cell, the physiology of the neurons, the physiology of the glia. There are many different substances in the brain. But how do these physiological, pathophysiological alterations influence our behavior? It will remain a fantastic topic for research for decades. Frontal lobe, main function, motor behavior. Prefrontal cortex, ability to plan and to integrate cognitive and emotional functions. Parietal lobe, processing the tactile information. Occipital lobe, visual processing, and much more. Brainstem, organization of blood pressure, breathing, all the basic functions. I didn't put into this presentation studies showing that transcranial photobiomodulation to the brainstem has influence on arterial hypertension. Such a huge field that is still under investigation. our synaptic shelf. Communication between brain cells is a biochemical event across the small, tiny little spaces called the synapses. And these can be investigated by EEG. Everything in our body is in a constant swinging, is in resonance. And we use this resonance to measure brain function, for example. We use resonances to measure heart function as well. Our thoughts, feelings, actions, memories, imaginations are the result what happens in our synapses and in the neurons. How can we influence this? Do we want to influence this? How can we nourish imbalances in this area? Well, PBM may be one of the promising, fantastic options without reported side effects after 5 decades of use of photomedicine. EEG do reflect what's going on in the neurons and in the synapses. The brain waves recorded in the EEG are characterized by the frequency we just mentioned, by the amplitude in microvolts, and usually when we do EEG recordings, we do the 1020 system for EEG recording. We will go into detail what we performed and why the appliance of a specific resonance to the prefrontal cortex can influence the EEG in the whole brain by using the 10 Hertz resonance from external irradiation. Well, which wavelengths do penetrate through the skull bone? Maybe almost all wavelengths do have some penetration through the skull bone. All the studies that have been performed over the last basically 2 decades for transcranial photobiomodulation used red, visible red light, so about 650 nanometers, or non-visible near-infrared light. We know from the transdermal irradiation, if we want to irradiate a tennis elbow or golfer's elbow, these are the 2 wavelengths, it's a range of wavelengths, of course, that are best for penetration as well. Shorter wavelengths are absorbed by melanin, by water, and we have this optic window for penetration of photons into the tissue. This covers red and infrared. And I will show you quite a few slides demonstrating that these are the best wavelengths for the transcranial irradiation as well. Well, the easiest thing we can do for photobiomodulation is, well, wound healing. Fantastic results, numerous studies. If you go to PubMed and put in photomedicine and wound healing disorders, you find a huge amount of studies, quite a few very good quality studies showing the terrific effects of photomedicine. But this is a superficial problem. Now, as you see in this cartoon, when we irradiate from outside, we have to go through all parts of tissues. We have to go through the hair, or we cut the hair, we shave. We have to go to the skin of the scalp. Then we have to go to the periosteum. Then we have to go to the skull bone. Then we have to go to the dura mater. then we have to go to the achnoidea, then we have to go to the pia mater, then we have, like in all the tissues, lots of blood vessels. And depending what disease we treat, we have to go into the gray matter, Alzheimer's disease, traumatic brain injury, stroke, or we have to go deep, 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 deep into the brainstem when we talk, for example, about Parkinson's disease, where we will see later on, but you all know, in the basal ganglia, the substantia nigra is affected and not producing enough dopamine anymore. There we need to go much, 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 much deeper into the brain, and we may need different wavelengths and different applicators for proper treatment of these different diseases. Well, most of the studies checking the penetration of transcranial low-level laser therapy used fresh cadavers. They applied the different wavelengths from outside and measured within the skull in fresh cadavers how many photons penetrate into the CNS structures. As I mentioned before, yellow light gives some penetration, but most likely only 1-2%. Red infrared gives higher penetration, near infrared most likely on average maybe 5% penetration of photons. Of course, once again, depending on the different devices you may use, and very much depending on the good coupling. If you irradiate from a distance, you of course have lots of reflection from photons from the tissue. The better the coupling to the skin of the skull is, the better is the flow of photons, the better is what we call the transmission of photons down into the tissue. At this point, I may excuse some slides I forgot to change. It's primarily a PowerPoint presentation, and here for the uploads, it's a PDF. So some information are covered with my summary. This is one of the studies looking on the transcranial low-level laser therapy and mitochondrial function in the animal model in aging mice. The summary, the conclusion of this study is the data indicate that transcranial LLT in both wavelengths, red, 660, 680, and near infrared, the typical are 808, 810, or 904, at a fluence of 8 joule per square centimeter, has the potential to ameliorate aging-induced mitochondrial dysfunction, apoptosis, and cognitive impairment. Just imagine if this would be true, and if this can be conducted one by one to the humans, what a fantastic potential. Alzheimer's disease and neurodegenerative diseases of the brain are one of the exploding problems these days all over the globe. If it's possible to use basically what's given by the sun, specific parts of the electromagnetic wavelength, specific colors like red and infrared, bring it into the brain. What happens in the brain? Basically, red infrared targets, as mentioned before, on the complex 4 of the respiratory chain on cytochrome C oxidase. We have shown ourselves with Professor Bergermann. This leads to an explosion of ATP production. Studies suggest 150 in the yeast cells, up to 300% increase in muscular cells, big increase in the CNS cells as well. And this gives the body the capability to induce repair mechanisms, to bring up the membrane potential, to reduce apoptosis, and to stabilize the synapses and gaining cognitive function and avoiding reduction of cognitive function. The wavelengths that have been discussed most of the time for photobiomodulation through the skull bone are red light, 650, 680, 780, 808, 810, 808, 810, for example, here. 904, for example, this one, 980, and 1064. If we go into higher wavelengths, first of all, the power of the photons is less. The longer the wavelengths of a photon, the less energy is in it. So UV, we can't use UVA for transcranial irradiation. Very short wavelengths, high energy within the photon. Near infrared, long wavelengths, less energy in the photon. And when we go to even higher wavelengths, the higher wavelengths use water as a chromophore. So if we use CO2 laser, for example, they get absorbed by water and do not let the photons penetrate into the tissue. They have the indication in ophthalmology, in dermatology, but they are not suitable for transcranial irradiation. 1064 may be one of the options because there is a very short, very tiny little reduction of absorption by water, but still I don't think it's the best resonance for transcranial irradiation, but this is my personal view and my personal experience. Laser therapy, photobiomodulation is mitochondrial medicine. For those who know me, I always like to call myself, I'm not a hypochondriac, I'm a mitochondriac. We all are mitochondrias. We all demand on the function, on the healthy function of mitochondria. Professor Luft from Royal Karolinska Institute talked at the first about acquired mitochondriopathies. And he stated, when 60% of healthy mitochondria are damaged in a tissue, a disease occurs. In the brain, it may be the Parkinson's disease or the Alzheimer's disease. In the heart, it may be myocardial insufficiency. It may be in the lungs, COPD, or other forms. As soon as 60% of healthy mitochondria are altered, we have problems in the energy metabolism of the cells. All different complexes of the respiratory chain in the inner mitochondrial membrane located have different absorption peaks. There are 5 complexes of the respiratory chain. Once again, see the introduction webinar. Complex 1 is NADH, NAD. It's the vitamin B3, absorption, UVA light, violet light, blue light. Complex 2, riboflavin, UVA, violet, blue light, absorption peak. Then we have complex 3, connecting my beloved coenzyme Q10 in its active form, in its reduced form as ubiquinol. And then we have the main target for photobiomodulation, the complex 4, the cytochrome C oxidase. I don't go into detail that the cytochrome C oxidase has different absorption peak in itself. Cytochrome C oxidase is different in absorption peak, whether it's in the reduced form or whether it's in the oxidized form. It has in one part copper, in the other part iron. And therefore, it has, let's say, basically 4 absorption peaks within the cytochrome C oxidase. Anyhow, this seems to be the most important chromophore, the most important antenna pigment for laser therapy for photobiomodulation. And in the end, what happens in the reduction of energy, we produce out of ADP, adenosine diphosphate, the universal currency of our energy, the ATP, the adenosine triphosphate. The last, the complex 5, is the magnesium-dependent rotator. And you see in the upper cartoon, the laser light targeting the mitochondria. And to all what we know from photomedicine, the mitochondria are the main target. There are many other targets, but the main target for photomedicine seem to be the powerhouses of our cells, the mitochondria. Therefore, all our cells contain mitochondria. The hair root cell, the CNS cell, the myocyte, the muscular cells, the liver cells, the kidney cells, all cells contain mitochondria. The higher the energy demand within a cell, the higher amount of mitochondria. To my experience, the higher the effectiveness of photomedicine can be if we manage to bring the photons into the damaged tissues. The mitochondrial effects of PBM are pretty complex. It's not only that we say we bring photons into the damaged tissue and enhance ATP production, which is of course important. When I have neuromuscular spasms, why does the muscles contract? The actin and myosin filaments are constructed and can't loosen anymore because there is no ATP. There is poor flow of circulation, poor flow of blood. And what does laser do? Laser brings energy, photon, into the tissue. They are absorbed by the chromophores respiratory chain. ATP production is enhanced. It loosens most up. Laser enhances micro and macro circulation. So there are many, many effects of the laser. One of the important facts when we talk about transcranial irradiation, basically it's suitable for other tissues as well. We have a temporary, once again, to what we know from the literature, we have a temporary increase of reactive oxygen species, short-standing reactive oxygen species, and these induce a huge variety of different transcription factors, such as NF-kappa B. And this induce a huge, huge variety of different repair mechanisms. So it's not only ATP that is enhanced, we have temporary increase of nitric oxide, of reactive oxygen species, and this may lead to renewing even of mitochondria. Mitochondria are not rigid structures in our cells. They are moving within the cells. They do fusion and fission. And the fission process seems to be positively influenced by photobiomodulation. We can do photobiomodulation targeting the mitochondria by different ways. Of course, most effective is the directly irradiation of the brain. However, on the last webinar, we talked about exosomes and stem cells. We briefly touched this later on as well. Even if we irradiate a distal part of the body, let's say, for example, the iliac crest or the tibia bone, we do have distant effects in our case, to the brain. When we look on the studies of Michael Hamblin, he postulates when we irradiate the tibia bone, we do have an effect for the brain. We know from our research and from Euron and others, when we irradiate the tibia, we have a booster of stem cells, especially the CD40 plus stem cells, especially important for endothelial regeneration. And they can penetrate through the blood-brain barrier and can induce repair mechanisms in the brain. As we will see later on, when we irradiate through one of the ancient parts of our brain to the hippocampus, we activate stem cells in the brain. Old guys like me who learned in medical school, once a CNS cell is gone, it's gone forever. Nowadays, we know the brain has repair mechanisms in itself. The brain can partially regenerate. If we irradiate to the area of the hippocampus, we learn from the Harvard Medical School, we induce the so-called BDNF, brain-derived neurotrophic factor, and by this, we can induce the new building of neurons, the new building of CNS cells, and we can even influence the neuroplasticity. We can activate the building of new synapses. Laser light is absorbed by healthy mitochondria and by damaged mitochondria. And the effects are different in the different tissues. I will show you in a minute. In the healthy neurons, photobiomodulation in healthy neurons with healthy mitochondria leads to absorption, of course, complex 4, CCO, cytochrome C oxidase. Positive influence, sodium, potassium pump. Increase of ATP membrane potential, increase of ATP, temporary increase of ROS, and increase of intracellular calcium. Calcium homeostasis is one of the very, very important metabolic physiological processes for our cells. And the fascinating thing is, the effect of laser is different on a healthy cell in comparison to a damaged tissue. What happens in the damaged tissue? We have already a huge increase of ROS, reactive oxygen species. We need ROS for everything has to be balanced in our body. We have to have a balance between reactive oxygen species and scavengers. If we have a damaged tissue, if we have a tissue that goes into acidity, into low pH levels, we usually have a high amount of reactive oxygen species. We have a decrease of the membrane potential. If it's zero, the membrane potential, of course, we are not alive anymore. PBM in the injured neurons, of course, is absorbed by CCO, cytochrome C oxidase as well. It increases the membrane potential much more pronounced than in the healthy cell, increases ATP. But now comes the fascinating thing to the research from Harvard Medical School. There is a decrease of ROS in damaged mitochondria by photomedicine. And we have a decrease of intracellular calcium. A high amount of calcium will damage the cell, will lead to exotoxicity. Calcium has to be balanced. The cell needs calcium, but if it's too much calcium, it's like, let's say, an atomic bomb. If in one cell is too much calcium, it will die and will release calcium, and it will influence the surrounding cells, and it growing and growing and growing and growing. And if we manage to stabilize the membranes, to reduce the calcium influx in the damaged tissues, we have a positive effect in preventing neurodegeneration. What are the functional mechanisms that have been described in transcranial PBM? I will say a little bit more about the wavelengths in a few minutes. If we look first in the center of this cartoon, believe me, let's say 5%, maybe it's 6, 7%, maybe it's 10%, as some researchers say, a small amount of photons penetrate through the hair, through the skull, through the dura mater, through the bone, through the pia mater, and go into desired tissue. Laser light enhances angiogenesis. So we build new vessels in our brain and in other irradiated structures as well. Laser light seems to induce the synaptogenesis, brain function, memory function is reflected by a huge amount of synapses. By laser light, we induce synaptogenesis. And I mentioned before, we learned 30 years ago, 40 years ago, even 20 years ago in many schools. And I was 2 months ago in India, and they didn't know that, wow, what's, not all Indians, but the classes I used to go. CNS cells can be rebuilt. Yes, there are different neutrophins that are induced by photomedicine. I mentioned the BDNF, the brain-derived neurotrophic factor, and the nerve growth factor is another growth factor that can be induced by photobiomodulation. So repair mechanisms, new building of CNS get induced. Fascinating, isn't it? Using part of the natural spectrum of the sunlight, using a natural source with a specific wavelength for treating of diseases, even for CNS diseases. For me, it's fascinating time and again. Neural progenitor cells in different forms are activated by transcranial irradiation as well. These are the beneficial things. Therefore, I put in this cartoon with green. And the dangerous or possible dangerous things in neurodegenerative disease, traumatic brain injury, and others get reduced. Transcranial photobiomodulation reduces apoptosis, reduces inflammatory processes. I'm fully convinced that things like Parkinson's disease is induced by a chronic inflammation with a chronic outburst of reactive oxygen species in the substantia nigra. Traumatic brain injury, we have always edema. Therefore, we sometimes do craniotomy to reduce the pressure on the brain with the laser. We have good evidence in so many studies that laser light enhances micro and macro circulation, enhances lymphatic drainage. And once the edema is reduced, I have a low risk of reducing secondary, the good chance to reduce secondary damages of the brain. And we talked about the calcium influx, for example. We even have good effect on neuron excitotoxicity. To my opinion, good wavelengths may be red, 660, 665 nanometers, 808, 810, and 904. And when we look into the studies from Michael Hamblin, we see that visual red light in the traumatic brain injury has some good effects. The best effects were absorbed by 810, 808, 810 nanometers in their studies. What we see clinically, the 904, that is, for example, given by this, is another terrific wavelength in neurodegenerative brain disorders. Other wavelengths like 730, 780, literally in their studies didn't have any effect, in the survival in the traumatic brain injury. Here another study that I like to share with you, showing the different wavelengths and their penetration depths and the flow of photons, the scattering of photons within the CNS structures. So first, if you look on the first block, it's visible red light, 660, 650, other diodes have, does obviously have some penetration of photons into the brain through the skull bone. Deeper penetration were observed and better scattering were observed with the 8-10 nanometers, whereas longer wavelengths, such as 980 in these studies, didn't have a good penetration of photons into the brain, into the gray matter of the brain. So we always come in most of the studies, or let's say we always, in most of the studies that I'm aware of, it's the 808, 810, or 904 with the best penetration and clinical results. Here, another study from Wang Riley from 2005. They come to the same conclusion as I mentioned before. Most effective wavelengths is visible red. Once again, some gave 650, others 670. This is visible red. And something around 810 are the most effective wavelengths. They are positively correlated with the absorption spectrum of the oxidized cytochrome C oxidase. Mentioned before, once again, complex 4, cytochrome C oxidase is the leading chromophore for photomedicine. Significantly, the last effective wavelengths is something around 728, 730 nanometers. And when we look into the absorption peaks, mentioned there are basically two big and two smaller absorption peak in the CCO, cytochrome C oxidase, 628, 728 is not among them. Therefore, maybe this is the reason why these wavelengths are not beneficial or not really effective in transcranial irradiation. You see in the lower part of the cartoon, the better the absorption of the photons are, the higher is the ATP production. And we call the oxygen consumption rate and the ATP production as one of the main targets for photomedicine in general, especially when we talk about transcranial irradiation. How does, we mentioned once again back, 800, 810, 808 are the best, but we have to be honest, even in this wavelengths, most of the photons get absorbed. It's only a small amount of photons that penetrate into deep parts of the tissue. So you see the depth in centimeters on the x-axis is significantly reduced with the distance. And in this study, they come to the conclusion the fluence of 808, 800 near infrared light is about 4.15%. So I always say on average, it's only 5% of the photons, even in the good wavelengths of 808, 904. It's only 5, maybe at the most, with best coupling to the tissue, like this flexible tips. We may get up to 10% of flow into photons, the fluence of photons into the tissue. Therefore, we decided in one of the studies that will come after the break that something around 904, 905, especially with super pulsed probes, brings the best, the highest amount of photons down into the gray matter, down into the CNS. From these calculations, it was that 80% in 808 were absorbed, more than 95% in the 980 were absorbed superficially and couldn't penetrate. So we have the best transmission, the best fluence with a 904, and the best with a super pulsed probe, even better than the CW continuous wave mode. Many studies have been produced over the years. There's a study from 2014, Transcranial Low-Level Laser Therapy enhances learning, memory, and neuroprogenitor cells after traumatic brain injury in the mice. They worked with 810 nanometers and could demonstrate that by irradiation transcranially, laser light after traumatic brain injury, the neuronal death was significantly reduced and neurogenesis was enhanced. And the recovery of learning function, memory, running in the tumbling wheel was much faster if after traumatic brain injury, transcranial photobiomodulation was performed. Yeah, we had now about 1 hour. You get many basic informations about the effects of transcranial laser light, that it penetrates through the skull bone, that the ancient part of our brain, the hippocampus, is the seat of neurogenesis. By transcranial photobiomodulation, we stimulate the BDNF, the brain-derived neurotrophic factor. We regenerate neurons even in the traumatic brain injury after stroke situations. Let's have a break of 50 minutes until German time, quarter, oh, it's only 10 minutes. Yeah. Let's have a break of 10 minutes until quarter to 6, and then come few research, but then coming to the medical conditions where photobiomodulation has been applied. Write down your questions already for the Q&A in the end of the webinar. Thank you very much for now. See you in about 10 minutes. Where do I get the laser helmet? Make contact with the organizer of the webinar, and they will send you a quotation for the helmet. It's near infrared helmet by Photon Care Germany, and send an email to the organizer. You'll get the email and phone number, though you don't have it later on. And there you can make any contact, even if you have any questions to the webinar in the end as well. Oh, there is already the number. Yeah. So the helmet and the transcranial irradiation with me. It's impossible to bring all the studies that have been conducted over the last 2 decades about transcranial irradiation in many different forms. You see it's anoxic brain injury, arthrothrombotic stroke, embolic stroke, traumatic brain injury, cognitive impairment, Alzheimer's disease, depression, a huge variety of different studies have been published and conducted, some using the traditional laser, some using LEDs. And as you see, most of the studies were conducted with the 808, 810 nanometers wavelengths. Few studies with near-infrared from above 1,000 nanometers wavelengths. This is an information I shared with you earlier on. If I want to induce cellular repair, I can do it either by directly stimulation of the central nervous system or by peripheral stimulation of the iliac crest, of the tibia bone, of the femur bone, of the thigh. There are many different possibilities. And I have a colleague, a veterinarian colleague, who always talks about the lucky punch of photomedicine. When he, for example, treats chronic sinusitis, the fatigue of the dog, of the horse, will vanish. So bringing photons into the body has, of course, the most pronounced effect onto the irradiated tissue, but all these seem to have systemic effects as well. Well, the human brain is a fascinating substance that gets targeted by basic science, neuroscience, and on the other hand, spirituality. With the use of photomedicine, we can cover almost all fields. The neurosurgeon may use a high power laser with a very small surface, with a very high power density to cut tissue. And we may use even low laser devices with a good resonance, with a good frequency, to alter psychosomatic disease, to alter depression situations. And yeah, basically spirituality has something to do with resonance focusing as well. You all know the 6 senses of the human, and you know that there are different ways to treat, to alter these senses. The hearing music therapy is in use for touch, tactile function. Brush therapy is used by the physiotherapists, the ergotherapists. Aromatherapy for smelling and tasting is in use. With photomedicine, we can integrate all these different concepts, and this is one of the big messages I always like to share. Photomedicine can be combined with any other form of treatment, and quite often boosting the treatments, the effectiveness of the other treatments. And more a vision for the future. We always talk about the six senses of the humans. For some people, it may be a nice option. For many others, it may be a frightening option. Will be in the future, or is it already among us, the seventh sense, the artificial intelligence? With all advantages in technique, in medicine, there are always chances and risks at the same time. I told you I will have a few words about the importance about resonances. Resonances. In some of my lectures, I bring shown on the right cartoon the Newton swing. I use a ball, let it go, and the same resonance information will be conducted on the next ball, next ball, next ball, and the last ball will swing the same way with the same resonance as the first. And this is the basic idea of the resonance therapy, giving an information to part of the tissue that it may spread to the tissue, and by this induce healing effects. There is a concept, not my concept, but many years ago, I think more than 2 decades ago, especially brought forward by the German physicist Fritz Albert Popp. Everything is in resonance. This is even much earlier than Fritz Albert Popp. Down to the atoms, everything is in a constant resonance. The electrons are in a constant swinging. Think of the Bohr atomic model. And Fritz Albert Popp said, a disease is characterized by a disharmonic swinging. Let's put it on our topic today. A seizure, an epilepsy is characterized by a totally disharmonic waves and spikes, by a chaotic depolarization of the membranes. If we manage to calm down these chaotic resonances, these totally disharmonic swingings that we can record, for example, in the EEG, we postulate by this we can regenerate health. We can assimilate the disturbances and bring into harmonic swinging. Once again, I have to mention Mike Hamblin, whom I met on several occasions. He's a biologist, but very, very interested and very familiar with medicine as well. He got so much money, so he could do many studies in the tissue, especially in the small animal model. They not only checked, as I presented before, about the different wavelengths. He suggested 808, 810 is the best. But he used different resonances as well. He used CW, 10 hertz, and 100 hertz. And by far the best survival rate, the best recurrence of motor function in the small animal model was by using the 10 hertz rhythm, the alpha rhythm. They don't know for sure what's the reason behind it, but they postulate it's the basic resting resonance of our brain. And if we bring the brain into the 10 hertz, we reduce the metabolic demand and we induce a further healing process. And we know from Chinese medicine that laser acupuncture over specific areas like the yin tang, the Du-Mai 20, really helps very much to calm down, focus, and concentrate, and to take out fear of the people. Paul Noget, the founder of ear acupuncture, of auricular medicine, was the first one who put huge efforts and ideas into different resonances. He calls the Noget A resonance, usually it's the middle A that is in use nowadays, 292 hertz, 292 impulses per second. 1 hertz is 1 impulse per second, is the resonance of disharmony, of acute inflammation. Nutritional resonance B, 584 hertz, 1168 hertz. The mesoderm, the neuromuscular muscular resonance. E, the resonance for the bone marrow, for peripheral nerve injury. So he detected for different tissues, different resonances. And they are worldwide in use. Let's come to the study I had the honor to do with a collaboration with the different universities in Tehran, Iran, especially with Dr. Sandy. We conducted a study using the 10 hertz rhythm, applying it to the prefrontal cortex, and look what happened to the brain on the EEG recording in healthy volunteers. They shouldn't have any history of traumatic brain injury. They shouldn't have any history of epilepsy, seizures, or anything like this. We used these super pulsed cluster probe to penetrate till the cortex and measure the EEG recordings after the setting I will give you in a minute. We did a 2 minutes EEG recording pre, then we did 30 minutes irradiation with 10 hertz rhythm, and then we measured 2 minutes EEG, 30 minutes waiting, another 2 minutes, 60 minutes waiting, and a third measurement. If we look into the EEG recording, there we applied the irradiation, and in this study, the probe was blinded. I switch it on now, and you see the bright flow of the photons. The red parts you see in the picture, and you see now in the camera. The red part is LED, just showing that the device is working, and the bright shining is the working laser. And in this device, the red parts were blinded, and near infrared light 904, our human eye can't visualize. So the treated volunteer didn't know whether the laser was working or just put onto the forehead. We applied 904 nanometers, 1 joule with the 10 hertz rhythm with a power density of 60 watt pores per square centimeter, and energy density of 0.2 joule per square centimeter, which means by 5 outputs, 1, 2, 3, 4, 5, we applied 1 joule per square centimeter altogether. And the fascinating thing was significant already after 20 minutes. First of all, the frontal cortex on the irradiated side, then on the opposite side, then the whole prefrontal cortex, then the postfrontal cortex, and finally even the occipital region of the brain went into the alpha rhythm. And when we had these students afterwards made concentration tests, when they had to pink out in a line B, 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 D, B, 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 the Ds, they performed significantly better than on baseline. So transdermal, transcranial photobiomodulation has a measurable effect even on this low flow of photons onto brain function in our study. And I postulate that's a general effect. So for enhancing memory function, for calming down brain function, we do not need this high amount of photons. We heard only about 5%, maybe 10% of photons penetrate through all the structures of the skull. So for the third time, I tried to summarize. I hope now everything will be stable again. We could demonstrate by this small study that even a small amount of photons, 1 joule per square centimeter, had a measurable effect on the brain function, reflected by an EEG recording. So maybe we shouldn't worry that only 5, maybe 10% penetrates through the skull bone. We still have the tremendous effect of photomedicine on the brain function. Having now a basic idea about biophotons, about the physiology of the brain, about the best wavelengths, let's go to clinical indications and suggestions about treatments. When we distinguish the two most common forms of neurodegenerative diseases, we have the diseases of the gray matter, the Alzheimer disease, and other forms of dementia. And we have diseases affecting the basal ganglia, such as the Parkinson's disease. Of course, it's much easier to target the Alzheimer's dementia because we can easily apply photons throughout all the brain with a helmet like this. Bringing photons down into the basal ganglia is a little bit more complicated. Some researchers now start to implant even laser devices into the direction of basal ganglia. What we could show in many patients, even in demonstrations in clinical practica, that the transdermal irradiation does have effect in these diseases. I don't think it's necessary to go into detail about the different form of dementia. The Alzheimer's disease is by far the most common form of dementia, causing, for some studies say 60, others say 76% of dementia. Others would be the Lewy body, Pick's disease, Jakob-Creutzfelder, Korsakoff after alcohol syndrome, and others more. This is the guy who described this disease. This is Alois Alzheimer, a German psychiatrist and neuropathologist. He was the first one who found a lady who lost her mind, dementia, losing the mind, losing the memory. And this is the first description of Alois Alzheimer about this disease. A very simple clinical test can be performed. Give a patient a circle and tell him, please mark on this circle 10 past 11. and many of these patients won't be able to, though you could tell 10 to 12 as well, many of these patients won't be able to perform this seemingly easy task anymore. This is a very, very superficial but very helpful tool to diagnose early stage of Alzheimer's disease. You all know we have a progressive degeneration of healthy brain structures. More and more the water-filled parts of the brain get enlarged through the dystrophia of the CNS structures. Many things have been discussed about Alzheimer's disease, about tau protein. To my opinion, it's a autoimmune disease where we have a chronic inflammation in the CNS. We have an increase of amyloids, of different peptides, of amino acids in the brain. And one of the leading factors is an increased apoptosis. We need apoptosis, it's the programmed cell death, but if it's elevated, we have a degeneration of CNS cells. And in an animal model, Zhang published in 2008 that transcranial LLT could inhibit this CNS cell apoptosis. Alzheimer's disease is described in the literature with increased ROS production, reactive oxygen species, with increased nitrosative stress, NOS, nitric oxidative species. It's characterized by inflammation, inflammatory processes. And Young and collaborators published a study using visible red light, close to 650 nanometers, 623. And by this, LLT suppressed cellular pathways of oxidative stress and inflammatory response, which are critical in the pathogenesis of Alzheimer's disease. And they could stop, with this approach, the progression of the disease in the animal model. We heard about the regeneration capacities of our brain. We heard about the BDNF, the brain-derived neurotrophic factor. And we know from modern research that in the early stage of Alzheimer's disease, even in the early stage, this regenerative factor is not properly produced by our brain anymore. And we know already from the Hamblin studies, from the traumatic brain injury, laser enhances the BDNF. So if we early diagnose Alzheimer and bring a right amount of photons in the tissue, we may have a terrific tool without side effects by just using electromagnetic wavelengths, by just using light to booster the BDNF and prevent the progression of the Alzheimer disease. So Meng et al. Could demonstrate LLT reduces the neural ROS, reduces the dendritic atrophy, and upregulates BDNF. And really, I think this is one of the leading studies showing the possible chances we can have, really with easy applicable tools like the helmet. To give you some ideas, we in our clinic have several of these near-infrared helmets, and in these patients having starting signs or even advanced stages, they come once or twice a week for irradiation with The helmet, initially, we start out with about 10 minutes irradiation. Then we go to 12 to 15 minutes, and in the end, they come twice a week for 20 minutes irradiation. We use it always with resonances. We always work either with the 10 hertz, the self-heal, the 4625 hertz, or the solfeggio resonance, 528 hertz. And the patients and their relatives are fascinated by the clinical results. Another field of research is to activate regeneration by stem cells. We can harvest stem cells from many parts of our body. It's the last webinar gewesen. It was the last webinar. We may use stem cells from our abdominal fat or from the fat of the thighs, extract the stem cells and give the stem cells by blood infusion. Some authors, researchers do intrathecal injection of stem cells. Once again, our skull bone is full of stem cells as well, and by irradiating of the skull bone, Hamblin says, we even release lots of stem cells by the skull bone as well. So one of the effectiveness of this helmet seemed to be not only the photo effect on the brain, but the activating of stem cells from the skull bone as well. Once we harvested the stem cells, we can irradiate the stem cells in the dish, in the tissue, or in the petri dish before re-injecting into the bloodstream or into the body. What we sometimes do, what we always do, once we infused the stem cells by IV, we would always use the photon care, the moonlight starlight device for interstitial intravenous irradiation. The survival of the stem cells demand on the sufficient supply of trace elements and the sufficient supply about the survival of the stem cells. Potential use of stem cells. We talk about CNS now, stroke, traumatic brain injury, learning defects, Alzheimer's, Parkinson's disease. Lots of research has been published on these diseases. Amyotrophic lateral sclerosis, another thing where we have some patients with very, very nice, very good results, sometimes in combination of stem cells and exosome therapy. Usually in a PowerPoint presentation, this would be step by step by step. So I still try to guide you through this overloaded slide. I have two slides, one proposed concept of what we perform in our clinics, prevention of dementia, or once it's early diagnosed. Of course, always we have to go into a detailed history. So we have to ask about heavy metals. Is there any, for example, aluminium containing food in the meals? Many of the black teas contain high amount of aluminium. Excess of white flavor products is a high risk factor. Excess of saturated fatty acids that are in animal-based substances. Trans fats, they don't exist in nature, but high risk factor for chronic inflammation in any parts of the body. We talk now about neurodegenerative diseases, but basically the truth is true for any degenerative diseases. HVS, the trauma of the cervical spine, is a very high risk factor for developing of dementia. Trauma, emotional trauma, psychological trauma is described as a risk factor for dementia. We all should know nowadays about the gut-brain axis. So in our patients, we always do sophisticated microbiome analysis, stool analysis. We perform whole blood mineral analysis and vitamin analysis. Most of our colleagues will look onto the serum levels of the trace elements, but responsible is the mineral level within the cell. There, the minerals are working. It's not interesting what's in the theorem. This can only be a rule of thumb to look into the serum levels. We have to look in inflammatory parameters like homocysteine. We have to look into lactate pyruvate ratio, into the pH level of the blood, on the omega-3 index. We should look on lipid peroxidation and into cellular glutathione. Then we perform, once it's likely to be an early stage, then we perform on a regular basis the transcranial irradiation. Some of the patients who come from far distance purchase their own near-infrared helmets. We get good results with the superpulse cluster probe over the tibia bone or the anterior and posterior iliac crest to release stem cells. They penetrate, remember the slide in the beginning. We can have distal effects, distal irradiation, and have effects for the CNS, even if we don't directly irradiate. We usually perform intravenous laser therapy with moonlight, starlight. We bring different colors, especially yellow light for the regeneration of CNS structures, important. Yellow light seems to boost vitamin D production, seems to have a good effect for nerval regeneration. We use targeted intravenous infusion of vitamins. So I don't like to give vitamins by candle, by random, but targeted after having known by intracellular analysis what is deficient, then give it precisely and in a therapeutic dose, not only in a low dose. We give clear advice about the diet. We quite often recommend probiotics and prebiotics, and we combine often the photomedicine with acupuncture, especially laser acupuncture and auricular medicine. Once it's already obvious that it's advanced stage of dementia, then we go for constant maintenance of minerals and trace elements. We have more frequently follow-ups in our clinic, and we recommend in these advanced stages always not only the stimulation of stem cells by irradiation over the tibia bone, but harvesting stem cells from the abdominal fat or concentrating the stem cells from the bloodstream, and use exosomes to induce healing processes. We heard already about the basic studies from Hamblin and collaborators about traumatic brain injury and stroke. However, I'd like to give some more detailed information about these diseases. Here, a study from Thomas Sanderson from Detroit, Wayne State, Michigan University, a rat global brain ischemia model that was presented by Mike Hüttemann this year in targeting mitochondria in Berlin. He could demonstrate that in the ischemia and reperfusion, 88% of the neurons in the hippocampus died. One of the big things we have to keep in mind, it's not only the ischemia that is dangerous, but when the vessels go up again and the reperfusion occurs, then all this dust, this dirty substances, let me say like this, flow into the tissue and cause secondary disturbances, secondary diseases, in addition to the pre-existing ischemia effects. If he performed laser irradiation, 89% of the neurons in the hippocampus survived without laser. 90%, let's say it like this, 90% died with a laser, 90% survived. So it's just going to the opposite. And we heard what the hippocampus is the seat of neurogenesis. The hippocampus is where most of the BDNF, the brain-derived neurotrophic factor, is released. So I hope that this goes into clinic, and I hope this will lead to a totally new approach to traumatic brain injury and ischemia of the brain in stroke situations. It really can make the game changer in the treatment of traumatic brain injury and stroke. From the animal model, we know after global ischemia, the mitochondrial ATP synthesis is altered after 2 minutes. After 2 minutes, the ATP storages are emptied. What's the effect? The sodium, potassium pumps do not work anymore. We have neural membrane depolarization. We have release of potassium into the extracellular space. We have the exotoxicity. We have the pathological influx of calcium into the cell. And this causes secondary damage to the brain tissue, like the explosion of a bomb. On the other hand, transcranial laser therapy inhibited the NO synthesis activity and upregulates the transforming growth factor beta 1. I mentioned in one of the slides before, NGF. Improved behavioral performance in the rat, improved motor function following embolic stroke, and induced neurogenesis by transcranial laser therapy. I always give the authors and the publication year here in these slides. So researchers said, okay, we did see this terrific results in the animal model. So let's look in the humans. And there was this big study with 120 patients, 40 to 85 years of age, the NEST study, where low-level laser therapy was performed within 24 hours after stroke with 808, 810 nanometers near-infrared light. And as we have seen, I would say, to my knowledge, in all studies about photomedicine, no side effects were reported. This was the main indication of the NEST-1 study to go, is there any risk applying photobiomodulation after stroke situation? And it didn't cause any side effects. So it's a safe method for treatment once again. I don't think we have the time left to go in all the details what happens in the stroke situation. We have, of course, impairment of circulation. This leads to poor nourishing of the tissue. This leads to local edema. This leads to impairment of oxygen supply. This leads, as I described before, to changes of sodium and potassium pumps, depletion of ATP production, influx of calcium, exotoxicity, metabolic changes. So get me right, I don't claim that photobiomodulation is the only tool for the treatment of stroke, but in combination, keeping all of these pathological events in mind, we have a terrific tool to alter the cascade associated with a stroke in many different ways. Whether it's stroke or traumatic brain injury, the traumatic brain injury or the stroke causes local inflammatory processes, causes disbalances of the minerals, causes influx of calcium. I go from bottom clockwise, from the top clockwise, inflammation. We have mineral disturbances. We have calcium influx, exotoxicity. We have outbursts of reactive oxygen species. We have ROS. We have nitrosative spaces outburst. The vessels get attacked, the lipoproteins get attacked. We have increase of vascular permeability. We have increase of local edema. We have increase of mitochondrial dysfunction. And it gets worse and worse and worse. So it's not really a circle, but it's like a spiral. It's getting worse and worse and worse and worse. And with a laser, we can act in any form. Laser has an anti-inflammatory effect. Pro-inflammatory substances like prostaglandins are got less expressed. We enhance the ATP production, so we activate the sodium potassium pumps. We reduce the exotoxicity, the calcium influx. So you see on the right part, LLT, photobiomodulation, will result in reduction of brain edema, of reduction of intracranial pressure, will reduce the neural death, will reduce the apoptosis, will prevent the spread of the ischemic necrosis by calcium release. On the long run, will enhance motor function and increase of cognitive function and functionality. So all parts of the pathology that are associated with traumatic brain injury and stroke can be positively influenced by photobiomodulation. The ischemia associated with stroke and traumatic brain injury alters the whole function in our brain. This is first the physiological condition. We always have some ROS, some reactive oxygen species that are necessary for organizing repair mechanisms, for organizing transcription factors. In the ischemia, the cytochrome C oxidase is not activated anymore. We don't have enough ATP production anymore. We have an outrange of ROS production, and we have a shift of the membrane potential. The membrane potential from normal 80 to 140 millivolt is reduced to significant less than 80 millivolt. And once the perfusion, the reperfusion starts, outburst, an explosion of reactive oxygen species is brought into the tissue, and this may be more dangerous, more devastating than the ischemia itself. And Michael Hamblin and collaborators could demonstrate by the photobiomodulation this perfusion injury can be almost prevented. The laser irradiation could alter the changes in the membrane potential and could preserve the nerval structures, especially in the reperfusion situation. We covered Alzheimer's disease, we covered stroke, we covered traumatic brain injury. What's about other neurodegenerative diseases? What's about Parkinson's disease? We are not talking about changes in the gray matter. We are now talking about changes in the basal ganglia, in the ancient parts of our brain. And how can we bring photons in this area? How can we booster the inborn production of dopamine? You see on the right cartoon the typical posture of the Parkinson patients, bent forward, the tremor, the signature, the scripture of the patients will get smaller and smaller. The patient have difficulties to start, to begin. I have to go now to the toilet. I have to go now to the toilet. They have difficulties to start any movements. So in the Parkinson's disease, we have to bring transcranially the photons down into the basal ganglia. What's the Western approach in Parkinson's disease? We apply L-dopamine. Once you treat regular Parkinson patients, you will see that they have an constantly increasing demand on L-dopamine. The neurologists call it the L-doper syndrome, reduced efficiency, motoric fluctuations, and dyskinesia associated with a long-lasting high amount of intake of L-dopamine. Here, some research summarized from Hamblin, McGeer, and El-Masri, published within 2008 and 2016. On the left part, you see controls, in the middle, Parkinson, and on the right part, Parkinson photobiomodulation treated patients. One of the characteristics is the changes in the glia cells and the TH plus terminals. In the Parkinson patients, you see that the glia cells almost vanish totally. And if you perform photobiomodulation, you reactivate these structures. Photobiomodulation increases the anti-inflammatory agencies, decreases the pro-inflammatory substances. I mentioned as one of the substances the prostaglandins, but it has effect even on the leukocytes. It influences the glia response, and it leads to a greater survival, and this is what we're talking about, of the dopaminergic neurons. So according to these basic studies, photobiomodulation, transcranial photobiomodulation seems to be a terrific tool in the treatment of Parkinson's disease. How does LLT act neuroprotective? First, near-infrared light acts on a cellular level, activating intracellular cascades that ultimately contribute to the survival of the target and possibly neighboring cells and stimulating neurogenesis. We heard this already in the stroke and traumatic brain injury. Secondary, near-infrared irradiation appears capable of triggering systemic protective mechanisms by enhancing ATP production and reducing the metabolic downbreak in the striatum area in the substantia nigra. We can have directly stimulation of the neurons that have beneficial effects, stabilize the membrane potentials. Then we can induce repair mechanisms, so we can induce neurogenesis, and we can prohibit the apoptosis. So we have 3 levels in which photobiomodulation in Parkinson's disease seems to have beneficial effects. You know, I always focus on the fact that it's not photobiomodulation on its own, that especially in complex diseases like Parkinson's diseases, we have to bring together many different treatment options. And for me, Parkinson's disease is a mitochondriopathy. Here, a study published in 2004, 70 patients with Parkinson's disease, all with measurable neurological deficits. And they focused on this study on the SOD, the superoxide dismutase. Our body has 3 different forms of SOD, superoxide dismutase. One is copper, one is zinc, and one is manganese dependent. And they could demonstrate a correlation between humoral immunity and activity of the antioxidative systems of the SOD and the catalase. What I want to show with this slide, when we have beginning or advanced stages of Parkinson's disease or other neurodegenerative diseases, we should look on the cellular situation. Parkinson is not dropping from the sky, but maybe at the root of the disease in a deficiency of copper, deficiency of zinc, deficiency of manganese. So I may put tons of dopamine into the patient, and maybe the main reason is a chronic depletion of copper, chronic depletion of zinc, chronic depletion of manganese. And we will have secondary diseases if we don't bring these deficient trace elements into the body, into the targeted tissues. And a lecture of Dr. Weber can't end without talking about my beloved coenzyme Q10. I don't know. 20 years ago, I was honored to be invited to different conferences, especially in the States, where I presented our studies on coenzyme Q10, on ubiquinol. And there were many studies presented at that time by Professor Flint Beal, who could demonstrate by a high dose, ultra high dose of coenzyme Q10, 1,200, 2,400, up to 3,000 milligram of at this time oxidated Q10 of the ubiquinone, could prevent the progression of the Parkinson's disease. Coenzyme Q10 was a safe and well-tolerated up to dosages of 2,000 milligram, and had beneficial effect in comparison to placebo, another study published in 2002, and slowing the functional decline in the Parkinson patients. Coenzyme Q10 is crucial for ATP production and is highly effective anti-inflammatory. Coenzyme Q10 in its reduced form as ubiquinol can scavenge radical-free oxygen radicals, two of the top in the porphyrin ring and at the head, and with each of the 10 of the isoprene parts of the tail can scavenge up to 12 ROS. So very, very highly effective substance for the cell membranes and at the same time for enhancing ATP production. So my recommendation in the Parkinson patient is not only transcranial irradiation, but giving a high amount of coenzyme Q10 in well-being 50 milligram of ubiquinol of the reduced of the bioactive Q10 is fine. In cardiac situations, 100 milligram usually will be good. But in neurodegenerative diseases, we need 300, maybe even 600 milligram of reduced coenzyme Q10. We have to achieve a level of 2.5 microgram per ml to have the beneficial effects. Vitamin C, we recommend in a retarded formula, 500 in the morning, 500 in the evening, or once a week, 7.5 gram per infusion, plus 1,200 milligram of glutathione, selenium, omega-3 fatty acids, very important omega-3 fatty acids, and folic acid. Be careful with vitamin B6. Vitamin B6 may boost the down breaking of dopamine. So give dopamine and high dose of vitamin B6 can be counterproductive. In the end, I may mention some acupuncture points for Parkinson's disease, like I described in functional medicine, in mitochondrial medicine. Don't give on random all minerals and trace elements. Find out which trace elements are deficient and give them in the right amount. Be careful with B6. And the same with the acupuncture point. Don't do all these acupuncture points that I've given here. Find out the root of the disease. And only treat the acupuncture points that are active, that are necessary. So this is only some brave overview of acupuncture points. For those who are familiar with ear acupuncture, with auricular medicine, there is a point called substantia nigra. You find this active in Parkinson patients, very effective for combination in the Parkinson treatments. It's inflammation, so anti-inflammatory points like interferon, thymus, buridol may be active. Many of the Parkinson patients suffer from major depression, so the anti-depression point is active quite often as well. I do love to work with Chinese herbs a lot, and the Yai Wai Gu Tangwan, the decoction that smoothens down the inner wind, is quite often very effective in the Parkinson patients. Chinese researchers will say the tremor is inner wind that it ticks, especially the liver responsible for tension relaxation of muscles, or the wood element in general. So it soothes out the inner wind It moves the blood, it nourishes the blood, it strengthens the liver and strengthens the kidneys. So it's a good decoction in many patients of Parkinson's disease. Depression in general, and especially depression in Parkinson's disease, can be another target for photobiomodulation. In the end, I'd like to share this study with you. Psychological benefits 2 and 4 weeks after one single treatment with near-infrared light to the forehead in patients with major depression and anxiety suffering from Parkinson's disease. One single treatment and measurable effects. We perform it regular in patients who develop depression, whether in Parkinson's disease or others. And we get most of the time good, in some patients terrific results. In some patients we can ease off in collaboration with the neurologist all antidepressive substances. Using light, using the power of electromagnetic wavelengths, using a part of the spectrum of the sunlight. And finally, in the end, I mentioned in the very beginning, it's not the topic of this lecture. We will have lectures on regeneration, hair growth in the next year. Here, patients from students of mine from Iran who performed PRP, platelet-rich plasma. They have lots of cytokines, mesenchymal stem cells, and exosomes in combination with our helmet, with a near-infrared helmet, applying the so-called self-heal resonances, 4,625 hertz, self-healing resonance, duration 15 minutes, after injection of PRP, after infusion of exosomes, and you see the terrific results. The stem cells only survive if we properly nourish the mitochondria. This goes by the targeted use of deficient minerals and trace elements and vitamins, and this goes by the proper use of photomedicine. If we talk about this area, the helmet is fantastic. If we want to boost or infused stem cells, we always should do intravenous photobiomodulation with moonlight, starlight, or other devices with the best wavelengths. Usually, we recommend 20 minutes of visible red light irradiation, 20 minutes of blue light irradiation, 20 minutes of near-infrared light irradiation. And in the neurological situations, always 20 minutes of yellow light irradiation. Let's come to the summary. What are the effects of photobiomodulation on our central nervous system? Photons, red 808, red 650, but better 810 or 904, penetrate through all these different structures and go down into the CNS. They enhance what I may call adaptive responsiveness. They can be used preventional. We activate the brain-derived neurotrophic factor, the neural growth factor, which is located in the hippocampus. We induce neurogenesis. We enhance synapses formation. By this, we enhance memory function. And we enhance the resistance to degeneration. We reduce the apoptosis. Next slide shows it. Now, whereas I dropped probably out. Yeah, that's will be in last one. I will come in to this slide in a minute again. What fascinating, what fascinating. It goes through the brain. It enhances regeneration. It prevents degeneration. Can go through the skull bone, has numerous beneficial effects in traumatic brain injury in the animal as well in the humans. I mentioned the NEST study in the humans. Fascinating wavelengths 808, 810, plus 904. 10 hertz has been investigated in detail by the colleagues from Harvard Medical School. However, if we have the right tools, we can bring photons in all structures of the brain. Stay in contact with us. If you have specific questions, we can develop together with you devices with which we can bring photons almost in any part of our tissues, not only the CNS. If we perform any form of photomedicine, never forget about what's going on in the cell. An arterial hypertension doesn't occur because I'm depleted of beta blockers. Arterial hypertension may occur because I'm depleted of magnesium. When I want to bring photomedicine at its best, think about the trace elements. We mentioned several times the complex 4, the cytochrome C oxidase. For this activation, we need copper. We have to have sufficient supply of copper, for example. Otherwise, cytochrome C oxidase won't work properly. Transcranial photobiomodulation is a new form of treatment without reported side effects. It can preserve mitochondrial function and cellular function, and by this prevent or even treat possibly neurodegenerative diseases such as Parkinson's disease or Alzheimer. It stimulates neurogenesis and synaptic plasticity, neuroplasticity as we call it. It should be combined for best effect with mitochondrial nutrition and vitamins. This was the slide I was looking for. The right part we saw before. Laser induces neurogenesis. And a new idea only can be preserved if we share ideas. So I hope you got some ideas about transcranial medicine, a transcranial therapy, transcranial photobiomodulation. Share these ideas for the benefit of our patients. If we don't share ideas and discuss ideas, I don't claim to bring the ultimate truth. I just like to share with you more than 2 decades of clinical experience of photomedicine, and now with 12, 14 years of transcranial laser therapy. Sometimes terrific results. And laser not only enhances the neurogenesis, but enhances neuroplasticity. The lasers, the neurons communicate better with each other. And it reduces the apoptosis and reduces the degeneration of CNS cells. If you get intoxicated, as I am, of photomedicine, join the next upcoming world webinar of the European Laser Clinics and Photon Care. It will be end of January, on the 22nd of January next year. We will talk about systemic laser, and this means especially intravenous photobiomodulation with the different colors. We nowadays have the capability to have all different colors of the rainbow for treatment. If you want to have further information, make contact with us. If you want to see the beautiful laser clinics, come to see us either in Germany or in Portugal. This is the European Laser Clinic in Portugal, Lagoa Cavoeiro. We're on 34 days of the year, the natural irradiation of the sun will do beneficial effects. Thank you very much for attending the webinar. Now it's open for question, and I hope to see all of you and your friends in the future again in upcoming webinars. And beginning of next year, we will have attending seminars again. Thank you very much, and stay healthy. Sure. Yeah, I guess quite a few of the audience are not familiar what the light stream is. Light stream is a class 4 laser. It's a class 4 laser, not a surgical class 4 laser, but it's a class 4 laser with a huge surface. So it can be used for bringing a high amount of photons into a tissue. The class 4 light stream works with up to 15 watt. So this class 3B lasers have maximum power of 500 milliwatt. So this works thousandfold more. 1 milliwatt, 1 watt, 1,000 potents. Yes, it's possible to use if you're experienced. If you are experienced, you may use light stream even for transcranial irradiation. Then you have to work with a low duty circle and with resonances. If you use light stream with 15 watt on a CW mode, you would first burn the skull tissue, and then you will get a warming effect in the brain. The brain doesn't have sensors for heat. So it's really advanced. I wouldn't advise to use class 4 laser as a beginner for transcranial irradiation. But it's possible, yes, with specific precautions and knowing how to use. Um, to be honest, right away, I'm not aware about studies about methanol-induced alcohol. It's always the methanol. It's not the ethyl alcohol. It's the methanol alcohol that easily can cause, even on small amounts, blindness. I would guess at an early stage, with powerful stimulation of stem cells, with infusion of stem cells, with using of exosomes, there might be some chance of regeneration, but I'm not aware about a study. I will write down in my notebook and we'll give a short, maybe on Facebook, maybe here, a short video if there is good research on this topic. The best investigated resonance for any forms of brain issues is the 10 hertz. So this is a good resonance. The other resonance is the selfie resonance, the 4,625 hertz. The other resonance that might be used with good effectiveness is the G resonance of Noget, or the middle G, 18,688 hertz. Yeah. Basically, this is a good option. Thank you for talking about this, offering this. If you have patients with complex problems, you can fix timing for an online consultation. At the best, you send us the medical history, the charts before, and then we can discuss with you or with your patients in detail on an online consultation first. Secondary, good, or thanks God, even the hemorrhagic stroke can be treated to what we see from the research with photobiomodulation. We don't have the risk that this would enhance the bleeding. Most effective seems to be in any forms of stroke, whether it's embolic or hemorrhagic stroke. We reduce the exotoxicity, we reduce the spread of neuronal loss close to the damaged area, and we early restore suitable membrane potential. Yeah, as you said, it's so huge range between the different countries and the different forms of treatment you offer. We didn't go even today in the most common forms of neuronal problems. We didn't talk about headaches. We didn't talk about migraine. 50% of the patients with recurrent episodes of migraine even benefit just by transcranial irradiation without any other methods. Transcranial irradiation by the near-infrared helmet using the 10 hertz, bringing down the metabolism, enhancing ATP production, and they get significant improvement or sometimes totally vanishing of their migraines without other complicated methods, without acupuncture, herbal medicine, trace elements. So obviously, then it's different than when you have to do maybe an hour history taking. When did it start? How often does it occur? What worsens it? What improves it? So really, it depends what you are searching for. I know colleagues to give you some numbers who do photobiomodulation in a session for €50. I know others who take for a full session with IV laser and transcranial laser and stem cell stimulation, 1,500 euros or dollars. It's nowadays equal for one appointment. So it's really a huge range. Yes, and this is probably a important information. The treatment with light is usually so important, so effective. I want to say so effective that when you really start out with this, after a while, you can live on laser treatments. People will come from many parts of your countries for the treatment. As for me, they come from all over the world. So last week I had patients from Greece and from Australia. The week before I had several patients from India. They once people realize the power of light, you get overload of work. Sorry. Quite a few studies show. Or let me go on one step back. The study I presented in the end, the depression. One treatment, significant improvement. One treatment in depression, major depression. Wow, it's unbelievable. The study using 10 hertz. One treatment and then performing concentration tests, significant improvement. Even with one treatment, you quite often see an effect, but it's of course not lasting. So to give a rule of thumb, 8 to 10 treatments, and you will have most of the patients students who want to get better grades at their universities, they come to 6 to 10 treatments and are happy afterwards. This, of course, is even more complex diseases, the amyotrophic lateral sclerosis. It's, for me, a severe inflammation of the motor neurons. So it's only partially target. You only partially target it if you only do transcranial radiation. Yes, they may get some benefits, but they need the full spectrum. They need, to my opinion, weekly or initially twice weekly, 7.5, 5 to 15 gram of vitamin C, 1,200 milligram of glutathione, 600 milligram of NAC. They need targeted supplementation, at the best IV, of B vitamins. 80%, up to 80% have depletion of selenium. They need initially selenium IV, then orally. When they get stop of progression of disease, fine, but most of them will need or we offer exosome therapy, and yeah, they quite of them get boostering effects. Um, my most beloved patient came in a wheelchair, not even being able to dress himself. After less than a year of treatment, he came in January, February. He sent me a parcel from close to Munich, with candles that he made with his children, and a lightning. He was able not to dress himself anymore, but to use a lightener. It's not always like this, but you get sometimes effects like this, even in ALS, in advanced stage of ALS. Uh, probably this is another webinar for next year. By abdominal photobiomodulation with laser shower or scanner, plus minus IV laser therapy, plus minus in really very bad states, bringing light directly by catheter into the gut. We highly effective can alter the flora of the gut. We can reduce inflammatory processes. We can bring down parameters of inflammation. Yeah, it's in these diseases a good option as well. Yeah, the main the main comment is keep open-minded, search for new answers. Don't I truly believe for almost all diseases on this earth, there is a possible answer. I don't have an answer for many questions. However, we should keep in discussion. We should keep open-minded, and yeah, a good, as the Chinese say, a good teacher remains a student until the end of the life. We should constantly learn from our patients. They are, at least for me, the best teachers, and yeah, let the mitochondria shine with the power of laser light. Thank you very much, and hope to see you online again, and one day, hopefully, in an attending seminar somewhere in the world. Take care. Good night. Goodbye. Thank you very much.